All right. Well, hello, everyone. Thanks for joining us here. And with me, I have Dr. Nikolas Hedberg. And Dr. Hedberg, we're going to discuss infections and thyroid health. And how you doing today, Dr. Hedberg?
Great. Thanks for having me on.
All right. Well, you are welcome, and thank you for being on. So before we start, I am going to dive into Dr. Hedberg's bio. So he is a chiropractic physician, a board certified chiropractic internist, board certified in nutrition by the American Clinical Board of Nutrition, and an herbal medicine fellow. And Dr. Hedberg is also the founder of the Immune Restoration Center in Asheville, North Carolina, where he consults patients worldwide. He is the founder of the Hedberg Institute, an online functional medicine education platform for practitioners of all types who want to build a highly effective and successful functional medicine practice. And he's also been a speaker for many years in the functional medicine arena, presenting on autoimmune disease and the connection between infections and chronic illness, which again is what we'll be discussing here. And then he's also the author of the book, The Complete Thyroid Health and Diet Guide, a comprehensive guide to understanding thyroid disorders from a functional medicine perspective and how to manage autoimmune thyroid disease. So, Doc, let's go ahead. If you don't mind, I'd like you to start out by discussing your background, how you started working with people who have autoimmune thyroid conditions, with also a focus, more focus. I don't know, currently, if you focus a lot on infections, but of course, with Hashimoto's or Graves, they are going to have infections. That's a potential trigger. So, why don't you tell everyone how you got started?
Right. So I first started practicing 18 years ago, and I was, building my practice and giving lectures around Asheville. And I realized that the thyroid lectures always drew standing room only crowd compared to all of the other illnesses I was talking about. So I knew there was something there that I really had to look into. And then patients started coming in, and they were just taking Synthroid, and it really wasn't working, not feeling much better. And so the combination of those two factors really drove me in the direction of focusing on thyroid. And then once you start to focus on thyroid, you realize that the vast majority of people with hypothyroidism have Hashimoto's disease, and there really is no medical treatment for Hashimoto's disease. So those patients are really left without many answers from the conventional side of medicine. And then as you dig deeper into Hashimoto's, you start to find out that a lot of practitioners are overlooking chronic stealth infections as the driver of autoimmunity. So, a lot of practitioners are focusing on really important things like gut health and vitamin D and things like that. But the infectious aspect I found over the years is usually overlooked, and that's just always been a main interest of mine: the immune system, chronic infections, and especially viruses. I'm definitely most interested in chronic viruses.
All right. And yeah, the same applies with Graves, of course. What most people with hyperthyroidism, they have Graves disease, and also people with Graves disease tend to have viruses. And this is not just clinical experience, but in the literature too. There's a correlation with both Graves and Hashimoto's for different infections. And of course, we'll talk about some of the different infections. And of course, the timing with the virus is great, just with everything that's been going on the last year and a half with the COVID situation. But let's talk about infections and like different. Well, why don't we start off by discussing how can an infection trigger an autoimmune thyroid condition such as Graves' disease or Hashimoto's?
Mm-hmm. Right. So the immunological description is very complex. There's 6 potential different mechanisms, but I'll break it down so that people can understand it and not go into tremendous technical detail. Uh, so basically, your immune system recognizes viruses, bacteria, parasites, fungi, things like that. And those immune cells attack those particular microbes. And in autoimmunity, the immune system is unfortunately making antibodies against your own tissue. So in the thyroid, it's thyroid tissue. So there are particular types of infections that can look similar to thyroid tissue. The immune system is looking at amino acids, so what those look like on the surfaces of particular infections and on the thyroid. And so it makes antibodies against whatever has those same amino acid sequences. So that's basically how it happens. There are other ways that it can happen, such as there can be, say, a pretty strong infection in a particular organ like the thyroid. And so there's a lot of debris in that area due to inflammation. And in that soup, the mix of debris and infection and self tissue, the immune system gets a little bit confused and it starts to tag the self tissue and the microbe that's in that particular organ as foreign. And so both get attacked. And that's called molecular mimicry. And we've known about that for quite some time. Actually, about 1972, it was discovered that cytomegalovirus was connected to lupus, and that was really kind of the first discovery. So it's not something new. So that's almost 50 years we've known about it, but that's basically how it works.
All right. And then besides potentially causing autoimmunity directly through that molecular mimicry mechanism, some pathogens such as maybe H. pylori parasites can also affect the gut, increase intestinal permeability of the gut. And could that also be a mechanism too, through that like triad of autoimmunity, where it's maybe not a trigger, but just making the person more susceptible?
Oh, definitely. Yeah. I mean, there's studies on intestinal permeability and leaky gut in direct connection with Hashimoto's disease and other autoimmune diseases. And you mentioned H. pylori. That's going to have an impact on multiple factors, not just in the gut, but on what micronutrients are being absorbed and utilized. So, yeah, some of these infections can definitely affect the gut and create dysbiosis and increased permeability, and that will lead to autoimmunity.
All right. So, why don't we talk about some of the different infections that you see more commonly in your practice with your patients? And or you could also, in addition to that, also bring up those in the literature. Like I know Yersinia enterocolitica is one I think associated with both Graves and Hashimoto's. But for example, I can't say I see a lot of patients with Yersinia when I do testing. But what are some of the more common infections that you see with your patients?
Right. Well, I'll start with Yersinia because fortunately it's missed very often in stool analysis. So it has to be tested in blood as well, IgG, IgM, and IgA antibodies. And oftentimes you'll find the stool analysis misses it, but it's active through blood testing. So that's one connected to Graves and Hashimoto's. The connection there is the surface proteins of Yersinia look just like thyroid tissue. And then H. pylori is another one that's very, very common. Now, the connections with H. pylori and Graves are stronger than they are with Hashimoto's, but there is definitely a connection with both. And that's, you can pick up H. pylori pretty accurately with a stool test. Breath testing and blood testing can also be done. But a lot of the studies on H. pylori and autoimmune thyroid disease, they are using stool. So that's a good way to pick it up. And then if you get deeper into the intestine, like blastocystis hominis, there used to be just one case study published in the literature on this particular parasite and Hashimoto's, but a paper just came out. It was either last year or the year before. Very good paper with direct connections showing blastocystis hominis was connected to Hashimoto's disease. And they went a little further. They actually treated the blastocystis hominis, and the patient's symptoms got better, and their immune markers got much better, and their thyroid health got better by eradicating the parasite. So it's one thing to just identify a particular infection connection. The other is, well, can we actually do something about it? And will that help the patient if you get rid of it? And blastocystis hominis, in that case, it does. And with H. pylori, there are some studies that show if you treat H. pylori, the patients can reduce their thyroid medication dose, and some of their thyroid markers can improve. So that's another connection there as far as treating the particular microbe. And then outside of the gut, and sometimes inside, the main one is going to be Epstein-Barr virus. This is going to be probably the most common virus in all types of autoimmune conditions. And there's a lot of literature on Epstein-Barr virus and both Graves and Hashimoto's disease. So those are really the most common. I mean, there's a lot of other ones like HHV6, herpes 6. There's some good studies on that, and Hashimoto's disease. Unfortunately, you can't really accurately test an adult for HHV6 reactivation. It's kind of an ambiguous way to know if it's reactivated or not. But viruses can transactivate each other, meaning that if EBV reactivates, it can activate another virus like HHV6 and vice versa. Now, with all the herpes viruses, the functional medicine treatment for them, if you treat one, say Epstein-Barr virus, that is going to be effective for all types of herpes viruses. So even if you don't know for certain if one of them is positive or not, if you treat one, you'll be treating the other.
Okay. Do you usually treat the viruses then with like an antiviral herbal approach? Is that what you take?
Yeah, so it's kind of a three-pronged approach. So the first is these, especially the herpes viruses and Epstein-Barr, they rely on what's called NF-kappa B, nuclear factor kappa B, which basically means that there's inflammation. And Epstein-Barr virus relies on that to proliferate. And so the first thing to do is to use some kind of anti-inflammatory that works on NF-kappa B. And the most common ones that I'll use are curcumin, black cumin seed oil, resveratrol, quercetin. Those are all effective for NF-kappa B. And then the second prong is you want to support natural killer cells and what are called CD8 T cells. These are cytotoxic T cells that control things like Epstein-Barr virus. So to support those, you'd want to use a mushroom, and I'll usually use cordyceps, and reishi could also be used in that case. So that's kind of the second way that you support it. And then the third is with monolaurin, also known as lauric acid. And this dissolves the fatty acid envelope around the virus, so it exposes it to the immune system, so it's not as stealth without that. So those are kind of the three things that I'll do to approach chronic viruses like EBV.
So regardless of whether it's EBV or cytomegalovirus or another virus, parvovirus, pretty much that approach seems to help. And so with EBV on a blood test, so if someone tests positive for EBV, the IgM antibodies, and that's more of an acute infection where maybe when they first got it years ago, the IgM marker would show up. So what's your take on people who have IgG markers? Because most people do have IgG. So do you pay attention to, like, there's 3 different IgG markers? I know I spoke with Dr. Kasia Kynes, who wrote the book, The Epstein-Barr Virus Protocol. She pays more attention to that early antigen antibody. Others are focused more on how high the antibodies are, like if they're, in triple digits or undetectable. So how do you interpret the EBV markers?
Right. Well, let's talk about what's very clear in the literature on Epstein-Barr virus diagnosis and interpretation. So you're exactly right. So the IgM is elevated during acute infection, and on average, IgM is gone in about 7 weeks. And then in the vast majority of people, that will not return for life. Now, the 2 IgGs that you're talking about, where people are just looking for elevations, the nuclear antigen and the viral capsid antigen, those alone can't tell you if there's reactivation. The only thing that can tell you if is that there's a high viral load where there's a high immune response, but that doesn't mean that there's reactivation. And so you do have to mainly look at the IgG early antigen. Unfortunately, the major labs like LabCorp and Quest, none of them have the early antigen on their standard panel. They just have those other three. So you do have to request to add the early antigen in. LabCorp used to include the early antigen, for the last 16, 17 years, and then they just took it out a year or two ago. So you do have to look at the early antigen. A few caveats there. The early antigen, there are some individuals genetically who will just have elevated early antigen for life, IgG, even when the virus is no longer active. So you do have to take that into account. And then it becomes more of a clinical diagnosis. And then you also have to look at the complete blood count, looking at their white count, their neutrophils and lymphocyte ratio. If you see the lymphocytes creeping up towards the neutrophils, that can be an indicator that there's chronic viral activity. And the early antigen, you could run it and it could be high, but it takes about 6 months for the early antigen to calm down and become negative once the virus is successfully deactivated. So you could also be in the middle of a successful deactivation of the virus, but it's still positive. So those are all really important things to know that a lot of people aren't looking at or don't know. So you don't want to jump to conclusions if the early antigen is high. You have to factor in all those other things that I talked about.
Okay. Now, thanks for sharing that. Do you test for Epstein-Barr and other viruses with pretty much all of your patients?
Not all of them. It really depends on how ill they are. A lot of them come in and they've already had Epstein-Barr virus testing, and 99.999% of the time, the early antigen is not included. So a lot of times if I am testing, I'm just doing the early antigen, not even looking at the other markers. But I test, I couldn't give you an exact percentage, but I would say the vast majority, I am looking for viral activity in patients with autoimmunity. And the vast majority come back positive.
All right. And then going back to the gut infection. So you mentioned Yersinia enterocolitica, you rely more on the blood testing. So I know what H. pylori, when H. pylori is positive and you treat H. pylori, from what I understand, you don't want to retest in the blood because those antibodies could take a while to get rid of. So is it the same with like Yersinia? If you detect that it's positive in the blood and you put someone on a treatment protocol, do you just put them on for a specific amount of time, or like how does that work as far as the retesting with the Yersinia enterocolitica?
Right. Yeah, I actually had to call the lab. So if you test Yersinia through LabCorp, say, they send it out to a specialty lab called a ROOP lab, and I actually called them and I had a long conversation with the pathologist there. If you really want to know about laboratory diagnosis, you want to talk to pathologists. And we talked about it for a while, and there's no real actually definitive way to be certain if the infection is successfully treated, if any of the markers are still elevated or not. So you run the IgG, the IgA, and the IgM, and now you can be pretty confident with the IgM that it's only going to be around for 7 weeks. So if you see that elevated, you know that it's a recent Yersinia infection. So they got it from some contaminated food or water. Most of the time, you're not going to see the IgM elevated. These people are chronic. So that leaves you with IgG and IgA. And the IgA, can actually still be high if the Yersinia is successfully eradicated. It can take a long time, over a year, for that to become negative. And so the IgG is really the last thing to look at. And once they've had it, that can actually go away completely. So it's different from a lot of IgG tests where usually they're elevated for life once someone's had it, but someone can have a negative IgG test in this case. So the main purpose of the blood test is just to identify if they have it and it's relatively recent, or if you see the IgG and the IgA are both positive, that's a really strong indicator that it is an active infection.
All right. Well, thanks. Thanks for that. And what H. pylori, how commonly do you see that in your patients?
I mean, it's very common just because of my patient population with Hashimoto's, probably anywhere from 60 to 80%, somewhere in that range. It's positive. Now, H. pylori is a little bit tricky with the interpretation, especially if you're doing stool. So, like, I use the GI map test from Diagnostic Solutions, and I've had long conversations with the lab developers there, and it becomes a clinical diagnosis if you see it. So you're going to see a particular number. And so that does mean that there is some H. pylori, there is some activity, which we would expect because such a large portion of the world has it. The question is it causing a problem? And if it's elevated, so if it's in the red and the clinical picture fits, like they're actually having symptoms of H. pylori, then that's a case where you would most likely want to treat it. But if they have, if they don't really have any gut symptoms at all and it's high, then I'm not going to, do an extensive treatment for H. pylori just because of the lab test if it doesn't fit clinically. And so that's how I approach those H. pylori markers.
Do you, when you do treat it, do you take more of a natural approach, or do you typically recommend the triple therapy that consisting of the antibiotics and the PPI?
Well, I do a triple therapy with triple probiotics. So I use a lacto-bifido blend, Saccharomyces boulardii, and a spore. I'll use all three types. And then a lot of those patients have hypochlorhydria, and strengthening stomach acid production, strengthening digestion, along with the probiotics is actually very effective for most people. If it isn't, then I just go in with a few herbal antibiotics for 3 or 4 weeks, and that clears it out quite nicely.
All right. Now that sounds good. And so talking about symptoms, so you mentioned that with H. pylori, you rely on the symptoms. Are there cases where when it comes to infections, where you don't rely on symptoms, where it could potentially be a trigger, even if the person isn't experiencing certain symptoms associated with that infection?
Yeah, I mean, almost all of them you can have. There might not be any symptoms. So HHV6 and Epstein-Barr virus, they might not really have any strong symptoms related to those viruses, but they're active. Yersinia, I mean, you can have Yersinia in the gut and it's there, but it's not really causing any major symptoms. So that's another one. And again, H. pylori, if they don't really have the symptoms of H. pylori, but they have a very strong autoimmune response, and we're doing a lot of the things that we would normally do, and they're not moving along the way that we would like them to, then I might go in and do a trial and knock it out in 3 or 4 weeks and see if we get some improvement. You're not really going to do any harm treating H. pylori alternatively, because we're not using antibiotics that damage the gut microflora. And just thinking of other infections that are connected there, like hepatitis C is, there's a really strong connection with hepatitis C and Hashimoto's disease. Actually, hepatitis C actually has a stronger connection with Hashimoto's than any infection that we know of.
Hmm.
In fact, hepatitis C can actually leave the liver and it can set up in the thyroid. It's called an extrahepatic reservoir. So it can move and it can infect there and drive autoimmunity. And some people with hep C, especially early on, I mean, they might not have any symptoms. So it's always a matter of doing some extensive investigation.
All right, and then parasites. So as far as the research, I don't think, I could be wrong, but I don't think there are any other parasites in the literature, at least associated with Graves or Hashimoto's. But have you seen from a clinical perspective where maybe not Blastocystis hominis, but another parasite is present, the person's symptomatic, and that seems like it might be a trigger where you treat the parasite and there's a positive correlation with their immune markers going down, their antibodies going down?
Yeah. So, right, Blastocystis hominis, it's really the only one that I've ever been able to find in the literature connected to thyroiditis of any kind. But, there is a, hypothetically, there would be some similarities with other types of parasites if you look at the blasto mechanism, because Blastocystis hominis is going to drive Th17, which drives autoimmunity. And people with parasites, not always, but a lot of them tend to have a Th2 polarization. And when you successfully eliminate any kind of infection that's driving Th17 or a Th2 polarization, then theoretically you would help the immune system and help autoimmunity. Um, Again, no strong evidence to support that other than Blastocystis hominis, but I'm sure you've seen it, and I've seen it, and other practitioners have seen it, where you treat the parasite and they do get much better.
Yeah, yeah, definitely. And of course, to be fair, many times we're working on other things too. It's not just the parasite as well. So sometimes it is difficult to make the connection, but there have been cases where I'm pretty sure it was due to a parasite that's not in the literature, and again
Mhm.
that greatly helps. So yeah, thanks for sharing that. And speaking of parasites, so you said you do the GI map, which I do as well. So would you agree that stool testing, I mean, it could be helpful, but also with parasites, it's not perfect. You could get false negatives. Now, GI map, again, it's DNA based. So arguably it might be, more accurate than other testing, but still there's always a chance for a false negative, correct?
Oh yeah, yeah. I mean, the way I explain it to patients is you have, like the villi in the intestine, and the stool analysis. I mean, it's mainly just going to pick up the stool that's passing over the brush border of the intestine, and so you can have, deeper infections deep in between the villi, and you can have parasites in there. You can have Yersinia. You can have all kinds of things, and there's no way to pick up everything that's in someone's gut on a stool analysis. It's just impossible. And so we can't go by that exclusively, just because of the depth of the spaces in between the villi.
All right. And then do you recommend after you treat someone for whether it's H. pylori or a parasite, a little bit different, like you said, with viruses, but specifically the gut infections, do you usually retest after treatment, or do you rely mostly on the presentation of the person and maybe some other markers like blood markers? Or
Yeah, I mean, early in my career, I would retest, and then as the years went on, I just tested less and less. And if the patient is feeling good and their symptoms are gone, then I leave it up to the patient if they want to retest or not. I have some patients who they just really want to see on paper that everything's cleared out and that they're going to be okay going forward. And then other patients, they're feeling great. There's aren't any indications that they have any ongoing infections, and then I say, you're fine, you're good to go. We don't have to necessarily spend the money and retest.
Okay, makes sense. And biofilm, do you use any biofilm disrupting agents like N-acetylcysteine or proteolytic enzymes when treating infections?
Right. Yeah, N-acetylcysteine is really the main one that I use for biofilms. The herbal medicines that I use, pretty much all of them disrupt biofilms. If I'm using something for an intestinal parasite or H. pylori or fungi, that's, I mean, the triple, probiotic approach plus the herbs, and then if it seems like a difficult case and we use some NAC, that's usually more than enough. There are, products out there that are designed for biofilms. I've used those in the past. I didn't really find an amplified, uh, successful outcome using those. So, the fewer the supplements, the better, the way I always approach things. And the things that I do usually work well without using those extra products. They definitely can work, but the question for me is always, do I really need them in this particular patient?
Makes sense. Thanks for sharing that. And how about stealth infections such as Lyme disease? I mean, viruses, I guess you could consider those as stealth infections too. But Lyme disease, co-infections such as Bartonella, Babesia, can those be potential triggers of autoimmune conditions such as Hashimoto's and Graves?
Yeah, I mean the literature is weak on all of the tick-borne infections, but there's a couple papers on Borrelia burgdorferi. That's the bacteria that causes Lyme disease and thyroiditis. Those are a little bit ambiguous, but any kind of strong infection that drives an immune response can potentially trigger autoimmunity. And there are a lot of anecdotal reports of rickettsia, which is also transmitted through ticks, and some other biting vectors as being connected to Hashimoto's. I mean, you do find in the Lyme community and in Lyme patients, a fair number of them have autoimmune thyroid disease. Now, whether that's those particular microbes from the tick, or is it just because their gut is so messed up from all the inflammation? Is it because they've been on so many antibiotics, which has caused dysbiosis and gut problems? Whether it's all the inflammation, the stress of having Lyme disease, and things like that. It could be any of those things. I can just say that the literature is pretty weak on the connections there, but you do see it a lot.
Yeah, that is true. I was diagnosed with or chronic Lyme 3 years ago, and I have a history of Graves' disease, and I was concerned that it might re-trigger. Unfortunately, it didn't, and I
Mhm.
tested all the thyroid antibodies, not just the thyroid stimulating immunoglobulins, but yeah, you mentioned stress. So one question is the impact of stress on infections, especially like viruses. And I mean, do you agree that to some extent they're more opportunistic? Like I guess if you could talk about the importance of optimizing one's immune system health, having healthy adrenals, improving stress handling. How much of a role does that help in preventing certain infections? Maybe not as much the gut infections, or maybe even the gut infections as well, but especially viruses, stealth infections, again, Lyme
Mhm.
disease.
It's a huge, huge factor, not just because of the what it does to the gut and the immune system, but lymphocytes have cortisol receptors on them, and chronic stress drives cortisol elevations, and that causes downregulation of cortisol receptors on lymphocytes. And so the immune response becomes weak over time the longer someone is under stress. And that allows these opportunistic infections to grow. So stress is, I mean, that's really number one in my practice, figuring out every potential possible stress input to the system and figuring out how to mitigate that, because you won't really get great results unless you're addressing all those factors. And stress also, adrenaline drives histamine, and histamine drives chronic viral activity. And adrenaline and cortisol, those both drive a Th2 polarization, which drives Th17. And unfortunately, Th17 cells are the major drivers of autoimmunity. So, whenever it comes to the immune system, there's always multiple factors there. You can draw out all the connections, and it looks like a big web. But stress is definitely at the one of the most important fundamental aspects of chronic infections and autoimmunity.
All right, definitely agree with that. I had a case of shingles a few years ago too, and I'm pretty sure that was just due to a ton of stress that summer. And yeah, so
Mm-hmm.
so I agree. Stress management, getting proper sleep, extremely important. And of course, diet, diet, lifestyle factors, very important. All
Mm-hmm.
right. Well, thanks, Dr. Hedberg. Appreciate you sharing all this information. It was great chatting with you about infections. So, can you share with the audience where they could find out more about you?
Yeah, my website is drhedberg.com, drhedberg.com. That's where I have my articles and my podcast, and that's for potential patients. And then the Hedberg Institute, that's hedberginstitute.com. This is for functional medicine practitioners, and I have functional medicine courses at the Hedberg Institute that they can sign up for and learn how to effectively treat all these conditions that we've talked about.
All right. Wonderful. And again, your practice located in Asheville, North Carolina, correct?
Yes, that's it.
All right. Well, wonderful. Again, thank you so much for doing this interview. And let's go ahead and see what questions we have here. So I will go ahead and share. So Diane, so how often do you see Hashimoto's in kids and in teenagers?
I don't really see a lot of kids in my practice. I've seen a number of kids and teens over the years with Hashimoto's. I just don't see a ton of them. Usually, kids and teenagers, they're usually in the conventional medical system because that's where parents usually want to take their children. But I will say that the ones that I have seen over the years, uh, kids and teens are really one of the easiest, if I can use that term, easy for autoimmunity compared to adults. Kids and teens tend to respond and heal much more quickly than adults. The key there, working with kids and teens, is usually diet. That's really usually the main issue. They're just consuming large amounts of gluten, dairy, and sugar on a daily basis, and just getting rid of those three just alone, I mean, you're going to have a very, very high success rate with young people just doing that. And if I can get them to take a few supplements, and then if I can get the parents to really get on board with the diet changes, kids usually do really well.
Yeah, I agree. I find with and most of my patient base also consists of adults, but with the patients I do see that are children and teenagers, that sometimes is the biggest challenge. And most of the time, the parents are on board because usually it's the parents that are, they're the ones, of course, scheduling the appointment for the. But sometimes it depends on the child that very difficult to get them to avoid gluten or sugar, and really to be on a whole foods diet. But it depends. There are also some very motivated children and teenagers that are willing to do everything because they want to feel better. So yeah, so let's see. Maria has a few questions, it looks like. So Maria, breath test shows that she's positive for H. pylori. She wants a natural protocol to treat it. We should not have a symbiotic relationship with it, right? The triple therapy gave me C. diff. So wants a natural approach. It looks like she took the triple therapy for H. pylori, got C. diff. And then, so you mentioned, again, you use, one of the main things you use is the 3 different types of probiotics. You said the Saccharomyces boulardii, the spore-based probiotic, and what was the other? Just the other one was like one that has like lactobacillus and bifido. Yeah. Okay. And do you use anything like mastic gum or black cumin or?
I do. Yeah. Okay. I use those for H. pylori as well.
Okay.
Now, usually though, just taking things for it isn't enough unless you figure out why it's there in the first place. So usually when people try to treat themselves, it's either not effective or it just comes back because the underlying reason isn't corrected. So now you can develop antibiotic resistant H. pylori the more times you take antibiotics. And C. diff, as you note here, creates a whole nother host of issues if it's ongoing.
Yeah, definitely. And actually, this next question I think relates to, well, actually, no, that doesn't relate. I thought she was going to say, so the mastic gum in the back, in the comments, I thought she was going to say it didn't help, but, and then, you're saying there's other things other than mastic gum, but she's saying she took the mastic gum, 1,000 milligrams, 2 tablets a day for months, but was told to stop it as it's not supposed to be taken for a long time. And yeah, I don't know your perspective. I mean, I guess with anything, I wouldn't want someone to take it for like 6 months. But if someone, I don't know if there's really any harm taking it in like for a few months if someone absolutely needs to take it for.
H. pylori is pretty. I mean, it's not that difficult to really knock out in a month. Sometimes maybe 6 weeks, a little bit longer. But if you're really taking the right approach, and, we can't really give treatment recommendations or specific recommendations here because everyone is so different. But taking, mastic gum for many months, that's obviously not, working or the right approach for you. So, if you can call someone like, Dr. Eric or someone who can really figure this out for you, because treating yourself usually doesn't give you good lasting results.
All right. Yes, agree. Actually, one question with H. pylori. What's your take with stomach like Betaine HCl? So with H. pylori could suppress stomach acid. Some will say to take Betaine HCl while you're dealing with H. pylori. Others will say to avoid it until and obviously you want to get to the cause of why you have the low stomach acid. But do you think it's a good idea to take something such as Betaine HCl while trying to eradicate H. pylori, or would you? And again, you can't give specific recommendations here, but in general, to your patients, what do you have them do?
That's going to be very patient specific. So you would not want to use Betaine HCl, obviously, if they have a stomach ulcer due to the H. pylori. And then some people with H. pylori have gastritis, and that can be another case where you would not want to use HCl, or at least not use HCl right away. A lot of times, you have to approach these things in stages based on the individual and what they're telling you about how sensitive they are to certain supplements or certain foods. What are the symptoms that they have? Do they have a lot of strong symptoms of hypochlorhydria? If they don't, then that isn't necessarily someone I would jump in and use that right away. If the stomach is a little bit more sensitive, more inflamed, they have gastritis, then you're going to want to do some gut healing first for a month or two before you go in and you start dropping extra acid into the gut, or harsh, herbs and things like that. So we can't, like you said, we can't really give a generic recommendation there. It's very patient specific.
All right. Now, thanks for sharing that. And actually, so Diane, so mast cells in the gut. I'm not sure. This is a question. POTS, EDS, kids born with Lyme, EBV. I'm not sure if this is tying into a question, Diane, but let's go ahead. Let's see. Okay, so Joy, what can I do to manage Graves' disease? So I'll quickly mention again. Everybody's different. So people with Graves, yeah.
I'll leave this question for you.
Okay, thanks. Yeah. So with Graves, some people do need to take antithyroid medication. So I assume you're talking about managing the symptoms, the hyperthyroid symptoms. Obviously, you want to try to address the underlying cause with both Graves and Hashimoto's, but some people with Hashimoto's need to take thyroid hormone replacement. Some people with Graves' disease do need to take antithyroid medication. I've said in the past that when I dealt with Graves, I was able to avoid the antithyroid medication. I took an herb bugleweed that has antithyroid properties. It doesn't work for everyone, but I was fortunate where it worked for me. I've had other patients where it worked, and I've had patients where it didn't work and they need to take methimazole, or a different type of antithyroid medication. So I would say, you definitely want to be safe while addressing the underlying cause of the problem. And, if that means taking a medication, so be it. If you need to, again, if you're not taking anything, then like myself, again, I wasn't taking anything initially when I was diagnosed. So I decided to take the bugleweed. I also took motherwort, which can help with the cardiovascular symptoms, but so can just bugleweed lowering the thyroid hormone levels. So again, it does depend on the person, but there's also plenty of information on my website as well as my podcast. You can visit savemythyroid.com and to learn more about managing the symptoms associated with Graves' disease, as well as trying to address the underlying cause. Okay, let's see. We got Monica here. So Monica has a high marker of IgA. So what does that indicate, and what do you recommend for further testing? So I'll let you take this one.
Immunoglobulin A is found on the mucous membranes in the body. So that's the sinuses, the lungs, and the gut. Those are really the main areas. So there's something irritating one of those mucous membranes in your body. That could be any number of things. It's usually an infection, but it could also be a food, any kind of antigen, something that's stressing the barriers of the body where IgA is. So, you'd have to see someone and they can figure out where to potentially look for the stressor on the mucosal barriers, and then do further testing.
All right. Well, thanks for that response. And then let's see. So Maria with another question here. So wish you would train and certify lay health professionals so we can help our communities. Thanks so much. I believe the Hedberg Institute, correct?
Mm-hmm. Yeah.
So yeah.
Mm-hmm. So we do. Yeah, we do train them.
Yep. So yeah, if there's any healthcare practitioners watching this, definitely visit that website. So it's hedberginstitute.com?
Yes, that's it.
Okay.
Mm-hmm.
All right. And I think that's it with let me just make sure I got all of them. So yeah, it looks like we are done with questions. Well, again, thanks, Doc. Appreciate you taking the time to again talk about infections. Appreciate your time, and again, hope everyone learned a lot.
Great. Thanks for having me. Enjoyed it.
All right. Take care. Take care, everyone. Have a great rest of your day and a great weekend ahead.